So insulin administration by pen. If you can, go ahead and watch the video here at Mercer County Schools. Today we're going to go through the diabetes. Chapter 9, insulin by pen. So first of all, if you are involved in this training, but it uses an insulin cartridge rather than a vial, and it has disposable needles. One of the diabetics that little bitty needle register to that pen. And us nurses, it is greatly preventing dose errors that may occur with this syringe. Secondly, I'm going to try to go through some of the test questions. Get your blood glucose meter prior to you may want to go administration or prior to lunch, and you're going to determine the insulin dose according to. And then I will also ask you to pause this video. You want to wash your hands to get all the equipment together, just like you did with the syringe. So click on the links and watch the pen needle. So we'll go ahead and get started. The alcohol pad, a Band-Aid, gloves, and so forth. So if you can, go ahead and click on these. You want to look at the insulin cartridge and just make sure that there's enough. So the Kentucky Board of Nursing Insulin Administration School Setting Program shall be conducted over a period of
so you're going to attach the new needle.
There is a little outer plastic cap on the end of that needle.
Done on an annual basis.
Just put it on a flat surface with an open end facing up. This is required. You can just stick the pin back down in that cap once you're finished giving the insulin. You're going to dial that pin to 2 units in order to do an air shot or a prime needle. Liability. And you should have a little drop of insulin appear at the needle tip. If it doesn't, you want to repeat that procedure. A medical procedure under this section. Dial in the dose. So if the students to get 5 units of insulin, you're just going to dial the bottom of that pin over to number 5. Clean the skin with alcohol. Go ahead and let it dry. Pinch the skin up at the selected site. FERPA, I'm sure you know at a 90-degree angle. About FERPA and HIPAA. You're going to push that plunger down and inject the insulin at a steady rate, that protects the skin. Certain rights to children's educational records. So health conditions and such also unscrew the needle and then dispose of it in the sharp. So information about a student's health should only be shared on a need-to-know basis. So the next one is insulin administration by pump. So just keep that in mind. We have several students throughout the district who have insulin pumps. They're getting more and more common just because incidence of diabetes. So about 283,000 Americans under the age of 20 are pretty accurate. So if you can, go ahead and watch the video. It's Chapter 10, Insulin by Pumps. In 2014 to 2015, the annual incidence of diagnosed diabetes in youth was estimated at 18,000. They're little computerized devices. They're about the size of a cell phone or a pager. And they continue. We'll get into deliver a continuous pulse. The difference in the types of diabetes shortly, where their pumps up to their belts or their pants are likely to be type 1 diabetic. And insulin is delivered through this tubing that ends with a short plastic catheter or metal needle. Overview of diabetes, the National Institutes of Health. And then you can see this is for their National Glucose Monitor for defines diabetes as a disorder of metabolism. So insulin is a hormone. So the pump contains a reservoir that holds insulin. It typically holds a 2 to 3 day supply of run-of insulin. The body does not use it. It is programmed to deliver a basal amount of insulin during the day and boluses as needed for meals and even though the body has high levels of glucose, the plastic needle is changed every 2 to 3 days. The student can disconnect the tube if it no longer makes showering or other short activities. An alternative source of insulin must be provided. It delivers a basal rate or injection in much of the same way as the human pancreas. So if the body does not use the insulin properly, healthcare team then will individuals must determine the amount of insulin and or other to be released throughout the day and they program the pump. Each pump is different. Your type 2 diabetics. So if you do have a student with an insulin pump, it may not be a bad idea to have that. If the student is able to let them show you about their pump or have the nurse show you. It's also important to know how to suspend or disconnect the pump in the case that a student becomes unconscious or has a seizure. The immune system attacks the beta cells, which is the insulin-producing cells of hypoglycemia in the classroom. You just want to get that pump. If you can't turn it off, disconnect it somehow, just get it, make it stop delivering insulin to the student. It can occur at any age. It often begins in children and young adults. A few more things about the pump. They're great. Research and treatment is ongoing. They're very handy. A lot of type 2 diabetes kids like them, but they can have issues. Response to insulin or it's insulin resistant. Students, if their blood sugars read for reasons scientists do not completely understand the body functioning, that it hasn't died, which means that it's not the body needs increasing amounts of insulin to control the blood sugar. So now we're going to talk about hypoglycemia. Some people with type 2 diabetes may hypoglycemia is when a student's blood sugar gets low. So I'll let you go ahead and watch the video. So type 1 diabetes, the symptoms are increased thirst, urination. So hypoglycemia is also called low blood sugar or low blood glucose. Risk factors can include
genetic
glucose
value
value
below 70.
And the American
milligrams
Diabetes
per
Association
deciliter. It is
recommends
the greatest
following
immediate
target
danger
blood
to
glucose
cause
range of
diabetes.
formulas.
Low
Can,
blood sugar can develop
toddlers and
within minutes
preschoolers
and
under
requires
180.
immediate attention.
Your school
Never
age
send a
kids
child
90
with
to
suspected
180,
low blood
and
sugar
adolescents
anywhere
and young
alone.
adults is 90.
If you've got a student who is starting to drop in your class and they need to go to the nurse to get snacks,
The goal of diabetes management
always
is to keep
keep
the
someone
blood sugar
with
in
them
just in
target
case they were
range
to
by
bottom out and lose
the
consciousness.
balancing between food intake, physical activity,
causes
and the
of
amount of
hypoglycemia.
insulin that they get.
Too much insulin,
Factors such as
skipping
illness,
or delaying
exercise,
meals or
and
snacks
stress can affect
not,
blood glucose.
not eating enough food to cover the amount of insulin taken.
Managing your diabetes
If they
can help
exercise
avoid
too long or
complications
intensely or
associated with it, and the
Um,
student should be able to
you know,
fully
like, if
participate
we have
in
a
all
child go
activities.
eat lunch,
We
and
do
then they
not
come to the
withhold
nurse to get
diabetic
dosed.
students from recess
About
or
2
anything
o'clock
like
that
that.
afternoon,
They're
they're
just
going to
monitored more
recess.
closely.
Their blood sugars
Already, like
complications
if
of
they're
diabetes.
they go
Taking
outside,
care of
and they
diabetes
run
is
for
important.
15-20
If
minutes.
it's not
and then
treated,
they're
it
down
can
to
lead to
70.
serious health
So,
problems.
which can affect the blood
It is
vessels,
a balancing
eyes,
act with
kidneys,
some of
nerves,
these kids,
gums, and teeth.
just keeping their blood
It
sugar
is the
in
leading
range,
cause of
but
adult
the
blindness, lower
hypoglycemia
limb
part of it
amputation,
can be one of the
kidney
most
failure.
dangerous parts.
People
of
with diabetes also have a higher risk of heart disease and stroke. Research shows
Symptoms,
that these
it is not
can be
always
greatly reduced
preventable,
or
and
delayed
not
by
all
keeping
students,
blood glucose
especially
levels near
young
normal.
children, will recognize the symptoms. It is imperative, therefore, for
So
us to
the
become
authorization
familiar
for
with the signs and
treatment.
symptoms.
The diabetes
So
medical
mild
management
symptoms
plan
can
is
include like
obtained on an
shakiness
annual
or
basis.
weakness, dizziness,
This
cold,
is the,
clammy skin,
orders that the
drowsiness,
nurses will
sweating.
get from the doctor's
They may look
offices, from the
pale.
child's endocrinologist.
Visual disturbances.
We have to
This
receive
is a
them
big one,
prior to
especially with
providing
the
care.
younger kids.
We will
They'll say
review
that
and
they're
in
feeling
collaboration
funny.
with parents, we will
They
develop
have numbness or
individualized
tingling
healthcare
of the
plans.
lips, yawning, headache,
Parent
confusion,
guardian
constant
signature is
strain.
included, which
Changes in
gives us
behavior
permission
and
for them to be
speech.
treated at school.
Some kids
It
will have
also
like,
has a written
they just know how they feel when they start
authorization
to
for the
drop,
diabetes
especially as they get
treatment,
older.
insulin, and
They just recognize
how much
it
insulin
more
we give
easily.
based on what they eat.
But like
and
if you're
to correct
elementary
their,
school age children,
glucose
sometimes
for
they have
lunch or
difficulty
breakfast,
expressing
and then
what's wrong.
glucagon,
So just
which
be
is the
aware
emergency
of
medicine if they need it for severe
the
low blood
symptoms
sugar.
and how they may possibly
If
act.
there are
if their blood
changes to
sugar
the
is
healthcare
dropping.
plan during the school year, the school
Severe
may
symptoms
require
of
a new updated
hypoglycemia,
plan in
they
order
can
to
include the inability to swallow. The child may lose consciousness in extreme cases,
Let's see.
or have
Here is
seizures.
another link. If you
So
will click on
symptoms
that
can
and
vary
watch it.
person to person.
And it talks
from
about the
episode to
diabetes
episode.
medical management plan.
Warning signs and symptoms of low blood sugar can happen suddenly and can be mistaken
So
for
parent guardian
misbehavior.
responsibilities.
Many students will not
we
have an
expect the
awareness
parents
to
of
provide
low
the
blood
school
sugar
district a
symptoms
copy of the
until
diabetes
around
medical
pages 7 or
management
8
plan.
years.
They will need to provide the school with all necessary medication and
So
supplies.
prevention of hypoglycemia.
And they should bring
snacks to
students
treat
should check their blood sugar
hypoglycemia
routinely. Testing in
So,
the classroom
um,
may need to be
we ask
allowed.
the
Parents
meals and
provide
snacks should
snacks
be
for
on a
classroom
regular
schedule,
as
especially
possible,
the younger
and
children
not
will
be
have
skipped.
snacks in the
The nurse's office.
Students should be allowed
As
to
a
eat in the
teacher, if
classroom.
you will have students in your
Injection
classroom, always a good
sites
idea
should be
because of
rotated.
walkdowns to go
The
ahead.
exact
and
amount of
keep some
insulin
snacks
administered should be
in your
double
desk
checked just in case the
Plan
student
for extra
doesn't have
food
anything
and
on them
reduce
and
the
they can't
insulin
leave the
levels
room
or
to go
exercise
retrieve
in
something
accordance with blood sugar starts dropping.
GMP. And increase the bedtime snack.
So, as a little
usually
review,
active days to avoid
type 1 diabetes,
hypoglycemia
it is
during
it's
hypoglycemia.
the inability
Just remember that
of the body
your
to
diabetic
produce
students will
adequate
need to have food and water in the classroom.
Number
because if
2,
they're running high,
hypoglycemia is another
then we may
term
ask them to
for
drink
blood
water.
glucose level.
And then, of course, if
And
their
that
blood
is
sugar
true.
is dropping, then we'll ask them to eat. And some students, we just text
So
them from the
principles of
Dexcom
of
or from the
medication
iPad in the
administration,
nurse's office or
The
from
Kentucky Board of Nursing
our
and Kentucky
phones,
Nurse Practice
and just have them
Nurse
eat
Practice
so that
Act
way they're
provide
staying in
laws
class
regarding
and
the
they're not
administration of
missing times.
medications in a school setting.
Medication
They may need to
administration to be
performed by
have
personnel
that
who do not hold an
So
appropriate
treatment of
healthcare licensure
hypoglycemia
must be under the
for
delegation
students who
of a
can
registered
swallow
nurse who
will
has
follow
made
the Rule
determination
15.
of the delicacy
So treat with
is
15
educational
grams of a
prepared
fast-acting
and
carbohydrate
forming the
source,
nursing task.
4 ounces of juice, regular soda. The glucose tablets, they're 4 grams for a tablet.
So
if they're
medication
dropping,
authorization,
they need to eat
like
like 4 tablets or so.
we
Lifesavers are
discussed this a
similar
little bit
changing.
earlier in the DMNP.
8 ounces
It's
of
just
milk.
written authorization that
A lot of kids will eat
from the
like
doctor
fruit snacks or gummies. And then you're
how
going
to
to wait
dose a
15
student
minutes
for
and then we'll
insulin and
recheck
so
their blood
forth.
sugar.
Any change
if it's less than target range,
in the
which is
medical
less than
orders
70,
must be in
keep
writing, and
repeating
we
the
must have
15
new
grams of
forms.
carbs and rechecking that blood sugar every 15 minutes until they're back in their desired range.
The 6 rights of medication administration with
so,
insulin. Like
right
if we have a
student,
kid at
right
2:30 in the
medication,
afternoon,
the right
they just
dose,
came in
the
from
right
recess,
time, the
their
right
blood
route,
sugar is
and the right
68. Then we're going to be calling the room or texting them.
So
You
each
need to eat
time
a
a medication is administered to a
gummies or a
student, a
snack,
record should be kept
and then
of the
in
name
15
of
minutes
the person
later, we're going to
administering
need to
it,
know what their blood sugar
who was
is,
receiving it, the name of the medicine, the time it was
and
given,
then
the dose.
if they're
and
unable
the
to
route
raise their
in which
blood
it was
glucose
given,
to greater
and
than
any
70
unusual
despite a
observations,
snack,
document
we have to
immediately
notify
after
the nurse
administration immediately.
If you also
Also,
remember
remember
a
if
nurse
they've got
at
the
the
nurse's
insulin pump,
office and a student comes
we need
in
to see how much
and they're
insulin is
injecting
still
themselves,
going in.
especially
They
if
sometimes
after
will have you
lunch,
verify the dose of
um,
insulin in the syringe
and so
and
forth.
just write down
So
what time
when
it
the
was
blood
given, how
sugar
much
is back up
they
in target
give
range,
themselves
which is
and so
usually
forth.
over 70, and it is time for a snack or meal, allow the
Nutrition.
student to eat.
Students with diabetes have the same nutritional needs as other students. All children need to eat a healthy,
If the
well-balanced
meal or
diet.
snack time is
diet
longer
to
than an
promote
hour's
optimal
time, or
growth
the
and
student will be participating in
The
physical
significant
activity,
difference
or
in meal
meal
planning
protein
for the
and
students with
snack,
diabetes,
like half
is that the
sandwich,
timing, amount,
and
graham
quantity
crackers,
of food
peanut butter, or
carefully
cheese,
matched to
and
the
the
action
salty
of the
crackers.
with peanut butter or cheese.
So
Something
carbohydrates
like that
affects
affects the
blood
protein
glucose
in it,
levels more than any other nutrient.
as well.
It is important to count the total amount of carbs
So
in a meal or
emergency
snack.
treatment of hypoglycemia.
Carbs are found in dairy
For
products,
those students who
starchy
can't
vegetables,
swallow
grains, fruits,
because their
juices,
blood
and
sugar
sweets.
gets so low, or
be
if they
sure
lose
to check for hidden
consciousness
carbs
or
or
start
start
having
having
a
seizure.
seizure.
This is a medical emergency. They may be unconscious,
So
unresponsive.
in diabetics, there are no forbidden
combative,
foods.
uncooperative,
So
or
if you have a
seizure.
diabetic student
Never
in your
attempt to
classroom,
give these students food
they
or
can
drink
have the
or
same
put anything in their mouth when
snacks
they're
and
experiencing
everything
these
that
symptoms.
you all have as classroom
Signs are so
snacks,
severe,
but it is important
that
to
the
count
student
the
cannot
carbs.
participate in care.
unless there's food allergies.
So you're going to have
Food
someone call
allergies, that's a
911,
different
school
story.
nurse.
For an
Diabetic
office will be
students
called
have
family
individualized
meal
meal get
plan based
assistance
upon carb.
of others to help
So
when
when
you're
we get
trying
the
to treat this
DMP,
child. Do not leave them unattended.
They take into account
follow the
the
emergency
medication
action
and
plan
activity
of
of the
the
emergency
emergency
medicine.
the insulin
So
dose
all
to help
diabetic
achieve
students
that
should have
optimal
emergency
glycemic control,
medication
keep
in
their
their
blood
diabetic
sugar
back
in
with
safe
safe
meter,
ranges.
their glucose
A
tabs,
carb
whatever
choice
else they
or
keep
serving
is the amount of food
that
that you're going to
contains
position them on their
15
side in
grams
a
of
safe
carbohydrates.
area. Most
Go ahead and find
starches
your
and
emergency
fruits,
bag
this is a half
and
cup
give them this
serving.
medicine.
It is important to read
After
the labels on
administration of
foods to
glucagon,
determine
as
the
they
number
start
of
regaining
servings in a
consciousness,
container and
nausea,
the grams of
vomiting,
carbs per
that
serving.
usually occurs.
So keeping them on their side will minimize
So
the
the
possibility of
carbohydrates
choking
for
if
school
they
lunches
should
can
vomit.
be found on the district website under menu.
After emergency
If they are
medicine is
serving
given, the
something
student
not
has to be
listed, we
transferred
may
to
have
the
to contact
hospital.
the cafeteria
Um,
manager.
This is
Only
if the
given
parent
if they
provides
cannot
food
take
from
anything
home.
They
like
should
food
provide the
without
carb
mouth. If the
food
student
item or
can
meal. So carb
eat a
counting
snack,
is best
drink a
most
juice,
often
then that's
done
when
in
you
one
need
of
to
two
do to get their
ways.
blood sugar up. The emergency
Consistent carb
medicine is
intake
only
meal
given
plan
if they
or the
lose
insulin to
consciousness
carb
and
ratio
cannot
plan,
swallow.
which is the one we see the most. Is the
So
insulin to carb
glucagon
ratio.
administration, the doctors will
kit.
write it like so many units of insulin.
So
per
for
how many carbs the
glucagon, if
student
you can
takes.
pause this presentation and watch it, it's chapter 6 on Safe at School. Some of the
But we
younger
will
students,
go
like
through
if the
the
parent
emergency
sends food from home, they'll put a
medicines,
post-it in the
hands-on
lunchbox
during
of
the
how much
check-off.
the peanut butter and jelly was, how much the
There
chips
have
was,
been a
and so
few new
forth.
medicines
So
come
the
out
big
in the
thing
last
with
few
the
years.
diabetics
Glucagon is the
carbs
oldest
to
one.
give them insulin.
It's the hardest one to use. Now there is Gvoke.
So
which
insulin
is-
to
we're
carb
gonna talk
ratio
about
plan.
that momentarily.
The
and,
insulin dosage is
Baqsimi,
based on two
which is a nasal
calculations.
spray. The
So
ratio
for
the
the insulin to carbs
glucagon,
and the
it will be in a
correction
red
factor.
container. You're just going
Student,
to open the
diabetic
kit.
students who have
um,
like a higher insulin,
If
prior
the
to
child
eating
needs
lunch, we'll get
glucagon,
a
if it's
correction
possible to wash your
factor.
hands and put on gloves, that's
And
great. But
lower that
if
insulin
you're in an
down.
emergency situation, you may not have
These
time to get all
ratios
that
are
done.
specified in the
If there will
diabetic
be 2 vials
medical
in the
management plan
glucagon kit.
by the prescribing
They're
healthcare
glass.
provider.
One of them contains a dry powder,
And they often change throughout
and the
year
other one
also.
contains.
If a child goes
I'm
back
sorry.
to their endocrinologist,
One of them
3 months
contains
after
a
school
powder,
starts and
and
the blood
then
sugar
there
is
is
high,
liquid
then they
in the
may
syringe.
increase that
So
insulin
you're going to
dosage
remove the needle
throughout the
from
day.
the top of the syringe,
But the
take the
nurses
fluid-filled
keep up with all
syringe,
that.
and then you're
Um,
going to
the
inject it
insulin
down
to carb
into
ratio
that,
is the
vial
amount of
that contains
insulin
the
which is
powder.
given to cover.
You're
the
going to
stated
roll it
amount of
around and
carbs
mix it
that are
until
eaten
it's all
or
dissolved.
are to be be.
all dissolved and it's clear. The prescriber will
And
call
then you're going to
express
hold the ball
it-
upside down
express
and
it at a
withdraw
ratio.
the
For example,
you've gone back down
1
into the
unit of
syringe.
insulin for every 15
The
cards.
prescribed amount should be
The
specified
amount
in the
is
student's healthcare plan.
individualized for each
Um,
person in their
And then you're
diabetic
going to
plan.
withdraw the needle from
And
the
the
vial.
ratio may vary It can be administered through clothing if necessary.
More at lunch than they do at
Suggested
breakfast.
sites include the outer thigh, upper
So
butt,
a sample
or the arm.
calculation of an insulin
Inject
to carb
the needle
ratio.
straight into the
So
muscle
if
of
the
the
student's
selected
one
site.
insulin.
We like to tell
is
people
1
to
to
use the
15.
leg just because
If they ate
a lot of
60
people who are
grams of
diabetic
carbs,
trained are also
then
medication
the formula
trained
to do that is 60 divided by 15.
So it's just
which is
easier
the
to
carbs
remember
divided by
reducing the O in that
the
muscle.
carb ratio.
After you
And
give
that
the
gives you
medicine,
4
you're going to
units of
withdraw the needle and massage the site.
Now, on the
And
younger
do not
children,
recap the
the
syringe,
nurses
put it in
we
the
try to
sharps
have
container
nurses in the building
and stay with the student. It
dose
may
those
take 15
kiddos.
to 20 minutes for the student to regain
On field
consciousness.
trips, you may have to coordinate with
make
the nurse
sure
about what they're going to be eating and how much insulin
EMS
they're
is
gonna
already
be
on the way.
taking.
Somebody's already called 911.
It's all
This
based
child will
on,
need to
it's
go
just
to the hospital.
individualized for each student.
Once you've got that emergency
They're your
medicine,
high school
then we need
kids,
to check their blood sugar.
They usually dose themselves, so it's talking to
Some
the nurse
students
as
may
well
have a
to
second
see what
injection of
that child will
glucagon
be
ordered.
needing.
If it remains low, they probably don't have a second injection in their
So the
diet.
correction factor
But,
is the
we're
amount of
just gonna say
insulin
what
the
the
student
student
needs to lower
keep
the
them
blood
safe,
glucose.
make sure that they're on their side in case they
So the
throw up.
target blood glucose
EMS is on the
subtracted
way.
from
Once
the
they
actual
start
pre-meal
regaining
blood
consciousness,
glucose.
they may be given sips of like fruit juice,
The
fruit
prescriber
juice or
will
soda,
specify
how much
once
their
insulin
weight
is
and they are
required
able to drink.
for results that are
Um,
over that target.
This may be followed by a snack containing protein
So
and carbs
correction,
like peanut butter
correction dose of
or
insulin
cheese
should not be
crackers
given
to keep the
within
blood,
the 2 hours after eating
sugar
carbs.
levels elevated to normal.
A previous
and to
correction
prevent
dose dropping
treatment
for
again.
low blood sugar. So if you look over here to
Don't
the
be
right,
surprised
since
if the student does not remember being unconscious. If they're incoherent,
So
they
if
wake
they
up or if they
are
have a headache. The
300
blood sugar may also
pre-meal.
rise over
So
200 and they
300
may
before
start
lunch.
having nausea and vomiting.
Their target
Just
glucose
because that
is
glucagon
150.
is that's its job
Then
is
the
to raise that
correction
blood
dose
sugar.
is
So
1
we're okay
unit
if it goes
insulin
high for
as
every
long as
50 that they come out of that episode.
They are over 150.
When emergency
So you're going to
services
take
do
that
arrive,
300,
which
which
is
is what they
transferred
were,
from medical
subtract
care
the
and
150, which is the target dose.
Make sure an administrator or the
Which
front office
equals
has
150.
contacted the parents and let
You're
them know
going to
what's
divide that
going
by
on.
50. That would be 3 units.
Make
of
sure
insulin just for
EMS
the
knows
correction.
that glucagon's been
So you would
administered,
end
what
up
time
adding
it was
that
given,
correction dose, the 3 units,
and just the
onto
details of
the
the
carb
insulin.
dose. And
So
we'll
this
have
is
another
the
example of
newest,
that in just a moment.
It's called Gvoke.
So
It's
now
a
we're gonna put it
pen.
all together.
So it is the actual glucagon,
So
but it is
The 2
pre-filled
calculations
permanently
are
with
then
anything.
added together.
So
to
there's no
obtain the
drawing up
insulin dosage
medicine.
for the
There's
child.
less room for error.
So
and
there's
quicker
quicker
delivery
delivery
with
with this insulin to carb ratio.
It's
is
pre-mixed
1
and
to
ready
15.
to use. There's
They
not
have
visible
60
needle
grams
in
of
it.
carbs at
It
lunch.
comes in 2 doses.
So let's just say they
0.5
had 2
for
peanut butter and
children, 1
jelly
for adults. We're going to give whatever's
The
in their
formula
emergency
would
bag
be
because that's their
60
dose.
divided by the 15 is 4 units of
And
insulin.
flexible to administer in multiple
So they're
locations
gonna
of the
get 4
body.
units of insulin.
I still
just
tell
based
people
on
to go
what
in
they
that
had for
leg.
lunch.
But this one can.
Prior to lunch,
It's a
their
smaller needle.
glucose
It can be
was
given in the
300,
stomach if needed.
and their target was
150.
150.
It's just easier to remember if
The correction
if it's-
dose is 1
if it's
unit of
all
insulin
the same.
for
So,
every 50 over 150.
during the training, I will
Then
tell
they
people
would
to go
get
in
3
the leg.
units of insulin just for correction.
Sorry about that.
So the insulin to carb dose plus the correction is
We will also
total
go through
units,
this
which
in
would
the
be
training.
7.
The
The 4 units.
The next
of
one
what
is
they have to
Bactimi,
eat
and it's a nasal
plus
spray.
3
It's
units of
correction.
correction
So it's an
because they
emergency
were
dry nasal
300
spray.
before lunch.
So
So if a student is going to lunch at noon, often the nurse will check their glucose
4
at
years and
11:30,
30.
either on the iPad or if the
Just
student
after
texts us,
administration, call
however they do it.
911, turn the person
And,
to their
um,
side, encourage the
Go
person
ahead
to
and
eat
figure
as
out
soon
how
as
many
they're
units of
safely
correction they're
able
going to need when
swallow
they get back to lunch.
acting source of sugar. I'll post the website.
The
for
insulin to carb ratio
Gvoke
method gives
and the
more
Bactimi
flexibility
in
to the
the
student,
page that
but
I've
it
sent in
may
the
also
email.
take
Just
more
please make
time
sure
and
you watch
attention to
both
track
of those
carbs
videos.
throughout the day. A parent or guardian should be notified in advance. by
So
the
a
school
little
nurse
review.
whenever special events are
Potential
scheduled that
causes
might
of
affect
low
your
blood
lunch.
sugar may include
This
the
includes
following:
after school activity,
too much
and field
insulin,
trips.
delay in
School
receiving
days when there is an
meal,
increased
physical
amount of physical activity,
or for its
may
all of the
necessitate
above. And that
necessitate
is
the
all
child
of the
having
above.
extra snacks.
When is
Examples
glucagon
are the
given
days
to
when
treat
there's physical education
hypoglycemia?
class or a field
When the
day.
student's blood sugar
They're
is more than 150,
provided,
the
the
parent
guardian is
every
expected to
afternoon.
provide
When
additional
the
food
student
and
is
snacks
unable
for
to
such
take
events.
liquid or food by mouth.
So it's also
or when the
important if
student
your
is
teacher,
tired or sleepy.
if you know a field
It
trip's
is
coming
when the
up and
student
is
is unable
diabetic,
to
don't
take
to let the
liquid or
school
food
nurse
by
know
mouth.
as soon as possible.
Glucagon is never given
So
to
that
a
way that they
student
can
who
plan
cannot
can
safely eat and drink to get their blood sugar up. How
about
physical activity,
it is 3
exercise
by
and physical
injection.
activity are critical parts of diabetes management. but physical activity can lower
Number
the
4,
glucose
the best way
levels.
to determine mom
Students with diabetes
hypoglycemia is determined by
PE,
checking the
and
student's blood
sports.
sugar, looking at the
To
child's skin
prevent
color,
high
asking them
blood sugar,
how they
low
feel,
blood
or watching
sugar.
for
They may need to
seizures.
check their blood
And it
glucose
is
levels more
checking
frequently.
the student's blood
A snack
glucose.
as well as a fast-acting glucose should be readily available. The student
So
should eat prior to
hyperglycemia,
exercising if it has been
I'll
more
let you
than
go
2
ahead and
hours
pause,
since they
and
have
it
eaten.
is
Chapter 4 on
Jim,
safe at
a
school.
lot of
Students
can
can
watch
drop
that video.
or outside of recess.
So
Just 'cause their bodies
hyperglycemia or high
work a
blood
whole lot
sugar,
faster and
or
they
high
can
blood
drop
glucose
quickly.
is when the level of
So,
sugar in the blood is
especially
greater
with the
than
little
240
students,
milligram per deciliter.
Elementary, intermediate
Over a
age,
long period
it's
of
not
time,
about
medium
being moderately
to high
diabetic
blood glucose
before
levels
you go
can
out
lead
to
to
recess
serious
to just ask them what the
complications,
blood sugar
like
is,
we
make sure
discussed
it's not
earlier.
already low.
Blindness, heart disease, kidney
The good
failure,
thing about the
amputations.
iPads in the nurses' offices
Short-term
are
hypoglycemia can result in poor
if the
academic
kids got the
performance,
Dexcom, then
minor
we
hearing
can
with the
see their
ability to
numbers from the
concentrate,
nurse's
reason.
office. If they're
Students who will be
dropping,
checking their blood
then we
sugars
can
at
also
various
see
times
that
during the day
once
are
they reach a
generally
certain
able to
level
self-treat.
of low,
However,
then they
students
start
may
alarm.
require occasional assistance.
But it's always
keep
good
in
to
mind too,
especially
when
with recess,
testing time comes around,
go low.
a lot of their 504s and such.
So monitoring the
will
blood
prevent them from
glucose,
being able to test if their blood
blood
sugars
glucose
are too
levels
high,
are measured in
because it
milligrams
may
per deciliter.
interfere with their thinking.
The
and
physician
stuff.
usually
So
requests
we'll
that
have
students
to
check their
really closely
glucose
monitor
or their
levels
blood
at
sugar
various
during
times during the
state
school day.
testing, such as before
Causes
snacks
of
or lunch,
hyperglycemia
before physical
can
activity,
include taking
and
too
when they
little
have symptoms of
insulin,
either a high or
ingesting
low
food that
blood
is
sugar.
not covered by the
The
appropriate
student's
amount of
doctor,
insulin,
school nurse,
or
a
other
decrease
diabetic
in the
usual
usual
amount
amount
of
of
exercise
exercise
or
or
activity,
guardian and student to determine
expired
the best
insulin
plan
or
for
insulin
treatment.
that was not stored
Though it
properly
can
and has
vary,
lost its
students
potency,
taking insulin
illness,
generally
infection, or
require
injury,
a minimum of 3 or 4
stress or
checks per
emotional
day. Upset.
hormone fluctuations.
So at the beginning
in
of the
certain
school year, the
medicines,
school nurse
if
usually
they are
collaborates
rebounding
with the
from low
parent,
blood
the
sugars,
teachers,
and
and anybody else
like if
involved
they've had several
in the
snacks
child's
to get their
throughout
blood
the day,
sugar up, then they
and they'll make a plan on
they may
when
jump up
and
pretty
how the
high,
student and
and
where
sometimes
they're
for
going
just
to
no
check their
apparent
glucose.
reason.
So in the afternoons,
if
you know,
have
a
a
diabetic
child
in your
after
class, you'll
lunch,
probably
if we
be meeting with
have
a school
not
nurse to
dosed
determine
enough
all that
insulin,
information.
either because they've not told us exactly
Here
how much
is
they've
2 more
eaten
videos
or
to watch. This
whatnot, then they
is
may go high.
detailed
Timing
demonstration
is very
of how to
important
monitor
in
blood
prevention of
glucose.
hyperglycemia.
The first one is for
the
a
American
meter,
Diabetes
and the second one is
Association recommends that
about
individuals
a
with
Dexcom.
diabetes stick to a schedule.
Adult supervision
Eat
should
on
be
time,
provided
check
as
their
indicated by the
students'
glucose on
experience
time,
with diabetes,
taking
taking
their
their
medicines on
maturity.
time,
and then exercise.
The important thing to keep in mind with the
Make
meter
sure that
is
insulin
you're
dosing
gonna have
is
a needle.
accurate as it is
So,
accounting for meals and
a
snacks.
lot of times they'll just go to the nurse's office to
like
check, so
when
they
you
can
have
dispose of that
afternoon
needle in a sharps container.
parties and such, the nurse
But
said
if a
need
child
to know
is checking in the classroom
what
what the
we have
child
had issues
eat
in
and
the
so
past
forth,
where
so they
the
can
meter
be
gets
dosed or the
appropriately.
needle gets dropped, somebody gets
So
stuck,
blood glucose
they stick
greater
it in
than
their backpack,
240.
somebody gets stuck.
Symptoms
So
can
it's
include
important
mild
to be able
increased
to
thirst, frequent
have a place to
urination,
dispose of
fatigue,
that,
sleepiness,
sharp spots in the
hunger, loss of
classroom if needed.
concentration, blurred vision.
Just keep that in
And they
mind.
may start having
I'll let
learning
you go ahead and
ketones,
watch these videos, and then we'll
zero
take
to small
the rest of
amount.
it.
Moderate. So the procedure for blood
sweet breath,
glucose
nausea,
monitoring,
dry mouth, stomach pains,
if
vomiting,
a student is checking
ketones,
with their
large,
meter, they
large,
should carry it with them
and then
throughout the
severe,
day in every
labor
class,
breathing,
going
very
outside
weak,
of
confused,
recess.
unconscious,
If they're wearing the continuous
when we
glucose
start worrying about the
monitor,
DKA that we
then,
discussed
that will
earlier.
stay
on their body, of course.
Anytime
But
though
for
we
the
have a
meter,
diabetic
the
student
parent
who's
will provide
complaining that they're not
necessary
feeling
equipment and
good,
supplies.
or
We do have
any
meters
symptoms
in every nurse's
out of
office.
the ordinary,
So
so always
we
just
ask
go
them
ahead
to
and
make
make
sure
sure
their
their
blood
hands.
sugar's
A lot of
stable.
times they don't. They'll just use an alcohol pad to clean the end of
So
their fingers.
hyperglycemia treatment, assemble the
the
supplies
unlicensed school
needed. They should
personnel
have
should
that in their
contact with
bag.
the registered nurse for
emergency treatment.
However, if their
The goal is to
glucose
lower the
reading
blood
is
sugar,
like super
uh,
high, or
student
just
has a
really
DNP,
off or not
and
witness,
you may want to have the student
consult
wash
to
their
determine
hands
plan
because
of
they could have
action.
something on their finger.
Treatment
that will
is
affect
dependent
your
on
reading.
how high the blood sugar is,
Whether
whether
or not there's
helping them check their
ketones,
glucose, and
and
there's
if
the
the
chance
student
you're
is
going to be
symptomatic.
touching blood, you need to put on
Possible
gloves.
interventions include administering additional
Make sure the
insulin,
alcohol is
encouraging
dry,
sugar-free
and
fluids,
then
such as water, and
diet
diet
to the end of
soda,
their finger,
checking their urine
cricket.
ketones,
Once
and
you put
limiting
the
physical
strip
activity.
down in the bottom
Um,
of the meter, it
So a
usually
lot of
turns it
times
on,
we'll call the
so then you'll
classroom
just
to have
put
a
a
student
drop
drink
of
water on that strip.
Students should have
And,
free and unrestricted access
It
to
will
water
read the
and
glucose reading.
sugar-free liquids in the restroom.
Sometimes if you don't get a good
the
stick, you
parameters
may
of they have to like squeeze their finger to get enough blood to come down is in the DMMP.
And then just cover the
hand with the
as long as you
or
have a nurse in the building, that it'll be doing that for the student.
Number.
prolonged hyperglycemia.
So here's a video for
checking
DKA.
ketones in urine.
Students
So
use
I'll
insulin
let you go
pumps
ahead and
and
watch that.
DKA in a matter of hours if their pumps start delivering.
So when the body can't use glucose, it uses its own fat
So a review
and muscle tissue for energy.
Symptoms of
Ketones
hyperglycemia
are acids that are
except
left in the blood when
pain
fat
in
is
the
used for
legs,
energy,
increased
a buildup of
urination,
ketones
drowsiness
in
or
the body can happen when there
irritability,
is not enough
and that
insulin
is
given or
number
produced
one,
by the
pain in
body.
the legs.
During an illness or time of
The treatment of
extreme stress or
hyperglycemia
dehydration may include which of the following.
If the body does not
following
receive
the
adequate
individual
amounts of
health
insulin
plans
so
or
that it can
extreme
utilize glucose,
the glucose
that
will
is,
rise and ketones will continue
A
to
and
build
B.
up in the blood. Increased levels of ketones result in a condition called
Storage
diabetic
and
ketoacidosis,
disposal
also
of
referred to
disposal
as
of medical
DKA.
supplies.
The body will try to get
Medications
rid of them
and
through the
syringes
kidneys
should
and the
be kept
lungs.
in
The
an
ketones
appropriately
will show
labeled
up in the
secure
urine
box
and may
container,
cause the breath to
cabinet,
smell
use
fruity.
needle syringes and
Other
lenses
symptoms
are to
may
be
include
disposed of
nausea,
in a properly
vomiting,
labeled
abdominal
box as a
pain,
trash
rapid breathing,
container.
thirst, frequent urination.
We have had
and
issues here in the district in the past
So
students sharing
students,
their meter.
we don't check blood
um,
ketones at
which
school.
is
A lot of them will check
a major
their,
issue.
urine
You know,
ketones
you've got
if
multiple
needed,
students using the
and
same
they may
needle.
have a ketone bottle in their diabetic.
We always remind students
If they
not to do
don't have
that,
a
and then
ketone
just
bottle,
making
we
sure
should
that
have
they
the
dispose
nurse's
of all of
office.
their sharps in the box.
So,
they don't need
for
to be
instance,
putting
if
it
their
in backpacks
DMP
or anything
says
like
check
that,
urine ketones,
if their
we have
glucose
had
is
parents send them like a
240
little
on
hard
laundry
two
detergent,
consecutive
like a game
checks,
container,
then they'll
for them
come to the
use in
nurse's
their
office,
backpacks
usually
for
pee in a cup,
people to
going
check
over
their
the
ketones.
complex, or if they have sports.
If it's
Just a small
we
amount,
really stick
most
with them
often
more
we'll
about them
follow the
getting
diabetic
sharps
plan, but we'll
containers 'cause we
contact
have
the parents
parents
if
here
they
at
have a
school
large
in the
amount of
past.
ketones, then they usually go
So
home and the
documentation,
parents need to contact their
students should have
endocrinologist or
individualized
diabetic
health
doctor.
records for documenting medication administration
because it can
and
lead to
completion of
DKA.
procedures. It's considered the 6 rights of med administration.
So, for instance, I had a student this year.
The documents are
came down
updated
to the
on
nurse's
annual
office
basis by the parent
breath
guardian
was
smelled
physician.
fruity.
So every year at the beginning of the year, his
July
glucose was
and
high.
August,
We
we
checked.
did
He had
the
ketones
new
in his
diabetes
urine,
medical
and come to
management
find out
plan,
his insulin pump
had died.
individual health care
around
plan
midnight the night
teachers
before.
and
So
nurses
he had
would
not
meet
gotten any
parents to
insulin
see what
since
all the
then.
child will need.
So I called his
and
mom,
the
and
emergency
she
care
went
plan,
home and
which is also
she
documented in
got
that
his blood sugar down
DMP.
and called
Documentation
diabetes
should include
doctor.
the following: glucose reading, carb
But
counts, and
once the
insulin
ketones
administration.
build up in the urine, it can lead
in
to
the scenario for
DKA
field
or
trips or
diabetic
nurses out of the
ketoacidosis.
building, just make sure that
So
it's
it is
wrote
important
down,
to detect and treat the
their
presence of
glucose
ketones
readings
early
to prevent the buildup of
ketones
ketones, dosing, and so forth, so we can document
that in Infinite Campus.
DKA is an
or let
emergency
the
and
nurse
the number
know.
one reason for the hospitalization of children with diabetes. So
Emergency
untreated,
care plan.
it can
Each student
lead to
diagnosed with
severe
diabetes should have
dehydration,
an emergency
coma,
care plan,
permanent
and a
brain
diabetes
damage, or
emergency
death.
kit.
It usually
The kit
progresses
should be
over
kept in
hours or
secure
days, but it
location.
may progress
As
more
discussed in the
quickly if the
medication
student's blood
storage
sugar
section
is
and
managed by an
student
insulin
and to
pump,
any
which may run out of
non-licensed
insulin,
staff member who
or
may
if
be
they have an
treating
illness or
hypoglycemia.
infection which causes the body
If
to
the
use
student
fat
leaves the
muscle tissue
campus,
for energy.
like to go on a field trip,
They don't
the
eat
emergency
adequately.
kit needs to go with the student. The label on the kit should state diabetes.
So the
emergency-
procedure for
emergency
checking
kit
urine
along with the student's
ketones:
name.
wash your hands. You'll need
for
a
each
bottle
student
of
in the
ketone
school with
strips, a
diabetes,
urine cup,
a source
if
of fast
you don't
acting
have a
sugar
urine cup,
and a
you can
small
just use
snack
like a
like
disposable
cheese crackers
water
and
cup,
juice box should be
gloves,
readily available.
and then you're going
It
to
is
have
the parent
to
guardian
guardian
responsibility
responsibility
to
supply
supply any
and
necessary
then you'll just
snacks
take a
should
strip
they
out
be
of the
needed.
ketone bottle,
And
and
as I mentioned
dip it down
earlier,
into
please
the
keep
urine
this in
and shake
for
off that
classroom
excess
lockdowns.
amount, and then wait.
All of the
the specified
diabetics,
amount of time on
they
the
all
bottle to
have
read
their
the
own
results.
little diabetic bags.
As you can
that
see
should
right
travel
here,
with
this
them
will show you
anywhere they
the
go, class to
ketones in
class,
it. So
school
you're going to compare the
complex,
color of the strip,
field trip,
whatever color it is on the end, to the
and that should include their meter
chart on the bottle.
or however they check.
So
their
in
sugar,
general,
their
if the
emergency
results are
medicine
moderate or large,
some of
the
them have
student should not
glucose
engage in
tabs,
physical
some of them
activity,
have
and the
snacks
parent
in
guardian should be called to take
and
the
so
student
forth.
home for observation
So
and your medical
make
care.
sure that your child
If
has
the urine
that, or
ketones
your
are
student
trace
has
or
that.
small, we notify the
any,
parent, increase
field
fluid
trips and
intake,
such.
and monitor the child.
And then here's
but
what
we'll follow the orders.
some of them
and
may contain
of
that
course,
what
if
I
the
just
parent
spoke
wants to
about.
come
Some
pick
of them
them up,
also carry
then they're
ketone
sent
strips,
home,
not
not
always,
always,
but we have those in the
just
nurse's
whatever is
office.
best for the student. So insulin
Skills
storage.
checklist required.
According
so,
to the American Diabetes
I have sent the link
Association,
out for
insulin
you
bottles
to sign up
should
for
not
an
be
in-person
kept
check
in
off
gain
on
diabetes
temperature.
temperature.
We're going to go through the
just
meter,
keep that in mind,
um,
like field trips, make
go
sure
through
your
some
diabetic
calculating carbs and insulin dose. If you
feel like you need.
So most types of open vials will stay
and then
fresh
insulin
without
administration
for up to 1 month.
and then the emergency
That's not
medicines.
something you all really need to know about, but I would just
So
keep in
other
mind,
important
especially when
considerations.
you're outside and it's hot. So here's another video I'll let you watch.
So,
It's on the different types
Inform
of
the
insulin.
nurses as soon as possible for field trips. Ensure that they have all their diabetic supplies to go anywhere outside of the building.
Insulin,
And then
basics
if you will have a
on the,
diabetic in your classroom,
safe at schools.
It's important that you meet with the nurse at the
So the
beginning
different
of the year.
types of insulin, there's rapid
And
acting,
the parents may want to meet with you as well, but the nurse will for sure go over stuff with the parents. As far as
So your rapid acting
blood
insulins,
sugar
they take
checks
effect
and
or
all
peak
that.
quickly, usually within 10
and
to
then
15
of course if we
minutes.
haven't got the DNP
These are used to
from
treat
the
high blood
parent or
sugars
physician
and to
yet,
cover
we'll
the
have to get
increase
that
of
as
blood
well.
sugar after eating and before
So if you
meals.
can,
By
by
now
now
you
should
should
have
have
watched all of the
insulin
videos
pumps
in the
and
Safe
referred
at
to as a
Schools,
bolus
as well
insulin.
as the other links that I've sent for the emergency meds.
So they take the injection
If
of
you
rapid
can, just
acting
go ahead
before
and complete
meals.
the test.
Make sure that they eat
And,
within 15 minutes.
sign up
We
for
do
a day
have
to
some
do the
students
in-person
throughout the
check-offs.
district who
And
dose
once again,
prior
thank
to
you
lunch.
all, the nurses
We
and
really
I,
do
so
try
much for
to
helping take care of these
persuade them,
students. The parent,
the doctor,
it takes a
inside
village
for several reasons,
and
especially if they're younger.
Good
because
luck
if they
for
go
the
to lunch and they don't eat
23-24
all that
school
they're
year.
supposed
Please
to,
email me
then
or call me if you have any
glucose
questions.
may bottom out.
Or we can go
Or
over
if they go
them
to
in the
lunch and they
in-person
get sick,
check-offs. Then it's
thank
hard to
you.
see
Enjoy the rest of your summer.
what all carbs they did take. But the majority of the kids will dose after lunch. Short-acting insulins, they are similar to the rapid-acting ones. They also may be called a bolus insulin, but their peak is delayed and their duration is longer. And then intermediate long-acting insulins are called basal insulins. They are not used to treat acute high blood sugar, but rather for coverage during times when the person is not eating overnight or between meals. School personnel will not be administering these types. These are usually given at home. So insulin dosage. Doses of insulin are measured in units. 1 unit of insulin can alter a blood glucose level. Therefore, it is imperative that the ordered dosage be exact. It should only be administered from a properly labeled prescription vial from a pharmacy, and specific written authorization from the student's healthcare prescriber and written parent guardian authorization is required for insulin administration. Written dosing instructions and consents are obtained in the diabetes medical management plan. So the procedure for insulin by syringe, I'll let you go ahead and pause the video and watch it. It is video number 8 on Safe at Schools. So the procedure for insulin by syringe, I hope the video was helpful, but the student should always carry their insulin in their diabetic bag with their meter, their glucagon, and so forth. You want to wash your hands, make sure you have all your supplies, and then you're going to take your syringe, draw up the amount of air like she said, put that down into the bottle, make sure you clean the top of the insulin vial. And you're going to withdraw the amount of units that the student is going to get from the bottle. Make sure that there's no air bubbles. Once you get that down, you can kind of flick the syringe to get the air bubbles out, and then push the syringe up to the amount of units that you need. We'll also go through this a little bit in the checkoffs for diabetes. As far as giving the injection, most of the students at the elementary intermediate age will have you administer the insulin if needed, like if you're on a field trip. Your older kids, middle school, high school, they're going to do it themselves, but have them pick the spot where they want it. Most of the kiddos will do it in the arms. If they're giving it to themselves, some of them will do it in their stomach, but you're going to pinch the skin, inject the insulin, count to 5 like she said, and then withdraw the needle. Do not cap the syringe unless you absolutely have to because of risk of needle stick injury. And then you're going to document all of that, how much insulin you give, the time it was given, where it was given, and so forth. So here's the insulin injection sites. Very rarely do we have kids doing it in the thighs or the butt. It's usually the abdomen and the arms at school. So here is the next one. So insulin administration by pen. If you can, go ahead and watch the video. It is Chapter 9, Insulin by Penn on the Safe at Schools. But it uses an insulin cartridge rather than a vial, and it has disposable needles. If you can see that little bitty needle at the end of that pen, it assists in preventing dose errors that may occur with the syringe. So get their blood glucose meter prior to insulin administration or prior to lunch. You're going to determine the insulin dose according to the DMMP. You want to wash your hands and get all the equipment together just like you did with the syringe. You'll need the pen needle, the alcohol pad, a Band-Aid, gloves, and so forth. You want to look at the insulin cartridge and just make sure that there's enough insulin in the pen itself. So you're going to attach the new needle. There is a little outer plastic cap on the end of that needle. Just put it on a flat surface with the open end facing up, so that way you can just stick the pen back down in that cap once you're finished giving the insulin. You're going to dial that pen to 2 units in order to do an air shot or to prime the needle. And you should have a little drop of insulin appear at the needle tip. If it doesn't, you want to repeat that procedure. Dial in the dose. So if the student's to get 5 units of insulin, you're just going to dial the bottom of that pen over to number 5. Clean the skin with alcohol. Go ahead and let it dry. Pinch the skin up at the selected site and put the needle in at a 90-degree angle. You're going to push that plunger down and inject the insulin at a steady rate, and then you can release the skin. Grasping the pen, you're going to place that pen back down in that needle cap, unscrew the needle, and then dispose of it in the sharps container and document the administration. So the next one is insulin administration by pump. We have several students throughout the district who have insulin pumps. They're getting more and more common just because they're easy to use. It saves students from getting stuck a lot, and they're pretty accurate. So if you can, go ahead and watch the video. It's Chapter 10, Insulin by Pumps and Safe at Schools, and then come back to the recording. So the insulin pumps, they're little computerized devices. They're about the size of a cell phone or a pager, and they deliver a continuous pulse of insulin. Students frequently wear their pumps hooked to their belts or in their pants or shirt pocket like a cell phone. And insulin is delivered through this tubing that ends with a short plastic catheter or metal needle, and it's inserted just under the skin. And then you can see this is for their continuous glucose monitor for their Dexcom over here. So the pump contains a reservoir that holds insulin. It typically holds a 2 to 3 day supply of rapid-acting insulin. It is programmed to deliver a basal amount of insulin during the day and boluses as needed for meals and high blood sugar readings. The plastic needle is changed every 2 to 3 days. The student can disconnect the tube from the set for sports, showering, or other short activities. It delivers a basal rate of insulin in much of the same way as the human pancreas. The healthcare team will determine the amount of insulin to be released throughout the day, and they program the pump. Each pump is different, so if you do have a student with an insulin pump, it may not be a bad idea to have that, if the student is able to let them show you about their pump or have the nurse show you. It's also important to know how to suspend or disconnect the pump in the case that a student becomes unconscious or has a seizure. So if a student has a severe episode of hypoglycemia in the classroom, you just want to get that pumped. If you can't turn it off, disconnect it somehow, just get it, make it stop delivering insulin to the student. A few more things about the pump. They're great. They're very handy. A lot of the kids like them, but they can have issues. If their blood sugar is reading really high throughout the day, you always want to make sure the pump is functioning, that it hasn't died, that it's not kinked, and so forth. So now we're going to talk about hypoglycemia. Hypoglycemia is when a student's blood sugar gets low. So I'll let you go ahead and watch the video. It is Chapter 3 on Safe at Schools. So hypoglycemia is also called low blood sugar or low blood glucose, and it is usually defined as a glucose value below 70. milligram per deciliter. It is the greatest immediate danger to students with diabetes. Low blood sugar can develop within minutes and requires immediate attention. Never send a child with suspected low blood sugar anywhere alone. If you've got a student who is starting to drop in your class and they need to go to the nurse to get snacks, always send someone with them just in case they were to bottom out and lose consciousness or anything like that. Causes of hypoglycemia: too much insulin, skipping or delaying meals or snacks, not eating enough food to cover the amount of insulin taken, if they exercise too long or intensely, or a combination of any of the above. Like if we have a child go eat lunch and then they come to the nurse, get dosed, about 2 o'clock that afternoon, they're going to recess. Their blood sugar's already like at 90 at recess. They go outside and they run for 15, 20 minutes, and then they're down to 70. So it is a balancing act with some of these kids, just keeping their blood sugar in range. But the hypoglycemia part of it can be one of the most dangerous parts of diabetes. Symptoms: it is not always preventable, and not all students, especially young children, will recognize the symptoms. It is imperative, therefore, for us to become familiar with the signs and symptoms. So mild symptoms can include like shakiness or weakness, dizziness, cold, clammy skin, hunger, drowsiness, sweating. They may look pale. Visual disturbances. This is a big one, especially with the younger kids. They'll say that they're feeling funny. May have numbness or tingling of the lips, yawning, headache, confusion, inability to concentrate, changes in behavior, and slurred speech. Some kids will have they just know how they feel when they start to drop, especially as they get older. They just recognize it more easily. But like with your elementary school age children, sometimes they have difficulty expressing what's wrong. So just be aware of the symptoms and how they may possibly act if their blood sugar is dropping. Severe symptoms of hypoglycemia, they can include the inability to swallow. The child may lose consciousness in extreme cases or have seizures. So symptoms can vary person to person and from episode to episode. Warning signs and symptoms of low blood sugar can happen suddenly and can be mistaken for misbehavior. Many students will not have an awareness of low blood sugar symptoms until around ages 7 or 8 years. So prevention of hypoglycemia. Students should check their blood sugar routinely. Testing in the classroom may need to be allowed. Meals and snacks should be eaten on a regular schedule as possible and not be skipped. Students should be allowed to eat in the classroom. Injection sites should be rotated. The exact amount of insulin administered should be double checked. Plan for extra food and or reducing insulin amounts before exercise in accordance with the DMMP. And increase the bedtime snack on unusually active days to avoid hypoglycemia during the night while asleep. Just remember that your diabetic students will need to have food and water in the classroom, because if they're running high, then we may ask them to drink water. And then, of course, if their blood sugar is dropping, then we'll ask them to eat. And some students, we just text them from the Dexcom or from the iPad in the nurse's office or from our phones, and just have them eat, so that way they're staying in class and they're not missing class times. But they may need to have that stuff in the room. So treatment of hypoglycemia. For students who can swallow, we're following the rule of 15. So treat with 15 grams of a fast-acting carbohydrate source. 4 ounces of juice, regular soda. The glucose tablets, they're 4 grams per tablet, so if they're dropping, they need to eat like 4 tablets or so. Lifesavers are similar candy, 8 ounces of milk. A lot of kids will eat like fruit snacks or gummies. And then you're going to wait 15 minutes, and then we'll recheck their blood sugar. If it is less than target range, which is usually less than 70, we keep repeating the 15 grams of carbs and rechecking that blood sugar every 15 minutes until they're back in their desired range. So, like if we have a kid at 2:30 in the afternoon, they just came in from recess, their blood sugar is 68, then we're going to be calling the room or texting them, you need to eat a pack of gummies or a snack. And then in 15 minutes later, we're going to need to know what their blood sugar is. And then if they're unable to raise their blood glucose to greater than 70 despite a snack, then we have to notify a parent or guardian immediately. Also, remember if they've got the insulin pump, we need to see how much insulin is still going in, especially if it's after lunch, and so forth. So when the blood sugar is back up in target range, which is usually over 70, and it is time for a snack or meal, allow the student to eat as usual, count the carbs, and give appropriately calculated insulin dose as ordered. If the meal or snack time is longer than an hour's time, or the student will be participating in physical activity, we're going to give a protein and a carb snack, like half sandwich, graham crackers with peanut butter or cheese, and saltine crackers with peanut butter or cheese. Something like that that's got the protein in it as well. So emergency treatment of hypoglycemia, for those students who can't swallow because their blood sugar gets so low, or if they lose consciousness or start having a seizure, this is a medical emergency. They may be unconscious, unresponsive, combative, uncooperative, or having a seizure. Never attempt to give these students food or drink or put anything in their mouth when they're experiencing these symptoms. Signs are so severe that the student cannot participate in care. So you're going to have someone call 911, school nurse, front office will be calling family. You need to get assistance of others to help while you're trying to treat this child. Do not leave them unattended. Follow the emergency action plan. Give the emergency medicine. So all diabetic students should have emergency medication in their diabetic bag with their meter, their glucose tabs, whatever else they keep in there. You're going to position them on their side in a safe area. Go ahead and find their emergency bag and give them this medicine. After administration of glucagon, as they start regaining consciousness, nausea and vomiting usually occurs. So keeping them on their side will minimize the possibility of them choking if they should vomit. After emergency medicine is given, the student has to be transported to the hospital. This is only given if they cannot take anything like food or liquid by mouth. If the student can eat a snack, drink a juice, then that's what you need to do to get their blood sugar up. The emergency medicine is only given if they lose consciousness and cannot swallow. So, glucagon administration kit. So for glucagon, if you can pause this presentation and watch it, it's chapter 6 on Safe at School. But we will go through the emergency medicines hands-on during the check-off. There have been a few new medicines come out in the last few years. Glucagon is the oldest one, and it's the hardest one to use. Now there is Gvoke, which is, we're going to talk about that momentarily, and Baqsimi, which is a nasal spray. So for the glucagon, it will be in a red container. You're just going to open the kit. If a child needs glucagon, if it's possible to wash your hands and put on gloves, that's great. But if you're in an emergency situation, you may not have time to get all that done. If there will be 2 vials in the glucagon kit. They're glass. One of them contains a dry powder, and the other one contains, one of them contains a powder, and then there is liquid in the syringe. So you're going to remove the needle from the top of the syringe. You're going to take the fluid-filled syringe, and then you're going to inject it down into that vial that contains the powder. You're going to roll it around or mix it until it's all dissolved and it's clear. And then you're going to hold the vial upside down and withdraw the glucagon back down into the syringe. The prescribed amount should be specified in the student's health care plan. And then you're going to withdraw the needle from the vial. It can be administered through clothing if necessary. Suggested sites include the outer thigh, upper buttock, or the arm. Inject the needle straight into the muscle of the selected site. We like to tell people to use the leg just because a lot of the people who are diabetic trained are also medication trained, and EpiPens, they're going in the legs. So it's just easier to remember. You're just going to go in that muscle. After you give the medicine, you're going to withdraw the needle and massage the site if you can. Do not recap the syringe. Put it in a sharps container and stay with the student. It may take 15 to 20 minutes for the student to regain consciousness. Make sure EMS is already on the way. Somebody's already called 911. This child will need to go to the hospital. Once you've got that emergency medicine in them, then we need to check their blood sugar. Some students may have a second injection of glucagon ordered if it remains low. They probably don't have a second injection in their bag. But we're just going to stay with the student, keep them safe, make sure that they're on their side in case they throw up. EMS is on the way. Once they start regaining consciousness, they may be given sips of like fruit juice or soda once they're awake and they are able to drink. This may be followed by a snack containing protein and carbs like peanut butter or cheese crackers to keep the blood sugar levels elevated to normal and to prevent it from dropping again. Don't be surprised if the student does not remember being unconscious, if they're incoherent when they wake up, or if they have a headache. The blood sugar may also rise over 200 and they may start having nausea and vomiting, just because that glucagon that's its job. It's to raise that blood sugar. So we're okay if it goes high, as long as that they come out of that episode. When emergency services do arrive, the student needs to be transported for medical care and document the incident. Make sure an administrator or the front office has contacted the parents and let them know what's going on. Make sure EMS knows that glucagon's been administered, what time it was given, and just the details of the incident. So this is the newest, it's called Gvoke. It's a HypoPen. So it is the actual glucagon, but it is pre-filled kind of like an EpiPen. So there's no drawing up medicine, there's less room for error, and there's quicker delivery with this pen. It's pre-mixed and ready to use. There's not a visible needle in it. It comes in 2 doses, 0.5 for children, 1 for adults. We're going to give whatever's in their emergency bag because that's their dose. And flexible to administer in multiple locations of the body. I still tell people to go in that leg, but this one it's a smaller needle. It can be given in the stomach if needed. It's just easier to remember if it's all the same. So during the training, I will tell people to go in the leg. Sorry about that. We will also go through this in the training. The next one is Baqsimi, and it's a nasal spray. It's the newest. So it's an emergency dry nasal spray. It's indicated for the treatment of severe hypoglycemia in adult and pediatric patients 4 years and above. Just after administration, call 911, turn the person to their side, encourage the person to eat as soon as they are safely able to swallow with a fast-acting source of sugar. I'll post the website for the Gvoke and the Baqsimi in the page that I've sent in the email. Just please make sure you watch both of those videos. So a little review. Potential causes of low blood sugar may include the following: too much insulin, delay in receiving snack or meal, physical activity, or 4 is all of the above. And that is all of the above. When is glucagon given to treat hypoglycemia? When the student's blood sugar is more than 150, before recess every afternoon, when the student is unable to take liquid or food by mouth, or when the student is tired or sleepy. It is when the student is unable to take liquid or food by mouth. Glucagon is never given to a student who can safely eat and drink to get their blood sugar up. How is glucagon administered? It is 3 by injection. Number 4, the best way to determine mild to moderate hypoglycemia is determined by checking the student's blood sugar, looking at the child's skin color, asking him or her how they feel, or watching for seizures. And it is checking the student's blood glucose. So hyperglycemia, I'll let you go ahead and pause, and it is Chapter 4 on Safe at Schools, if you can watch that video. So hyperglycemia, or high blood sugar, or high blood glucose, is when the level of sugar in the blood is greater than 240 milligram per deciliter. Over a long period of time, even moderately high blood glucose levels can lead to serious complications, like we discussed earlier: blindness, heart disease, kidney failure, and amputations. Short-term hyperglycemia can result in poor academic performance by interfering with the ability to concentrate and reason. Students who will be checking their blood sugars at various times during the day are generally able to self-treat. However, students may require occasional assistance. Keep in mind, too, when testing time comes around, a lot of their 504s and such will prevent them from being able to test if their blood sugars are too high, because it may interfere with their thinking and stuff. So we'll have to really closely monitor their blood sugars during state testing. Causes of hyperglycemia can include taking too little insulin, ingesting food that is not covered by the appropriate amount of insulin, a decrease in the usual amount of exercise or activity, expired insulin or insulin that was not stored properly and has lost its potency, illness, infection, or injury, stress or emotional upset, hormone fluctuations in certain medicines. If they are rebounding from a low blood sugar, and if they've had several snacks to get their blood sugar up, then they may jump up pretty high, and sometimes for just no apparent reason. In the afternoons, if a child after lunch, if we have not dosed enough insulin, either because they've not told us exactly how much they've eaten or whatnot, then they may go high. Timing is very important in the prevention of hyperglycemia. The American Diabetes Association recommends that individuals with diabetes stick to a schedule, eating on time, checking their blood glucose on time, taking their medicines on time, and then exercising. Make sure that insulin dosing is accurate, as it is accounting for meals and snacks. Like when you have afternoon parties and such, the nurse is going to need to know what the child eat and so forth, so they can be dosed appropriately. So blood glucose greater than 240. Symptoms can include mild increased thirst, frequent urination, fatigue, sleepiness, hunger, loss of concentration, blurred visions, and they may start having urine ketones, 0 to small amount. Moderate, sweet breath, nausea, dry mouth, stomach cramps, vomiting, urine ketones, moderate to large. And then severe, labored breathing, very weak, confused, unconscious urine ketones. This is when we start worrying about the DKA that we discussed earlier. Anytime, though, we have a diabetic student who's complaining that they're not feeling good, or any symptoms out of the ordinary, then we always just go ahead and make sure that their blood sugar is stable. So hyperglycemia treatment, the unlicensed school personnel should contact with the registered nurse for emergency treatment. The goal is to lower the blood sugar. The student has a DNP and is consulted to determine the plan of action. Treatment is dependent on how high the blood sugar is, whether or not there's urine ketones, and if the student is symptomatic. Possible interventions include administering additional insulin, encouraging sugar-free fluids, such as water and diet soda, checking their urine ketones, and limiting physical activity. So a lot of times we'll call the classroom, have the student drink water. Students should have free and unrestricted access to water and sugar-free liquids and the restroom. The parameters is when to notify a parent, guardian, or the physician is in the DMMP. As long as you have a nurse in the building, that they'll be doing that for the student. Prolonged hyperglycemia can cause a potentially life-threatening condition called DKA. Students who use insulin pumps can go into DKA in a matter of hours if their pumps start delivering insulin properly. So a review, symptoms of hyperglycemia include all except Pain in the legs, increased urination, drowsiness, or irritability, and that is number 1, pain in the legs. The treatment of hyperglycemia may include which of the following: administering insulin following the individual health plan, or administering glucagon, and that is A and B. Storage and disposal of medical supplies. Medications and syringes should be kept in an appropriately labeled, secure, locked container or cabinet. Used needles, syringes, and lancets are to be disposed of in a properly labeled biohazard sharps container. We have had issues here in the district in the past of students sharing their meter, which is a major issue. You know, you've got multiple students using the same needle. We always remind students not to do that, and then just making sure that they dispose of all of their sharps in the box. They don't need to be putting it in their backpacks or anything like that. We have had parents send in like a little hard laundry detergent, like a game container, for them to use in their backpacks for if they're going over to the complex or if they have sports. But we are really sticklers anymore about them getting it in the sharps containers, because we have had injuries here at school in the past. So documentation. Students should have individualized health records for documenting medication administration and or completion of procedures. It's considered the 6 rights of med administration. The documents are updated on an annual basis by the parent, guardian, and physician. So every year at the beginning of the year, in July and August, we get the new diabetes medical management plan, individual health care plan. Teachers and nurses will meet with parents to see what all the child will need, and the emergency care plan, which is also documented in that DMMP. Documentation should include the following: glucose reading, carb counts, and insulin administration. In the scenario for field trips, or if the nurse is out of the building, just make sure that it's wrote down, their glucose readings, what they eat for lunch, how much they are dosing, and so forth, so we can document that in Infinite Campus, or let the nurse know. So, emergency care plan. Each student diagnosed with diabetes should have an emergency care plan and a diabetes emergency kit. The kit should be kept in a secure location, as discussed in the medication storage section, and known to the student and to any non-licensed school staff member who may be treating hypoglycemia. If the student leaves the campus, like to go on a field trip, the emergency kit needs to go with the student. The label on the kit should state diabetes emergency kit along with the student's name. For each student in the school with diabetes, a source of fast-acting sugar and a small snack like cheese crackers and juice box should be readily available. It is the parent guardian's responsibility to supply any necessary snacks that may be needed. As I mentioned earlier, please keep this in mind for classroom lockdowns. All of the diabetics, they all have their own little diabetic bags that should travel with them anywhere they go, class to class, school to complex, field trips, anywhere. And that should include their meter, or however they check their blood sugar, their emergency medicine. Some of them have glucose tabs, some of them have snacks in them, and so forth. So make sure that your child has that, or your student has that, for any field trips and such. And then here's what some of them may contain, that what I just spoke about. Some of them also carry ketone strips, not always, but we have those in the nurse's office. Skills checklist required. So I have sent the link out for you to sign up for an in-person check-off on diabetes. We're going to go through the meter. We'll go through some calculating carbs and insulin dose if you feel like you need additional help on that, and then insulin administration, and then the emergency medicines. So other important considerations. So inform the nurses as soon as possible for field trips. Ensure that they have all their diabetic supplies to go anywhere outside of the building. And then if you will have a diabetic in your classroom, it's important that you meet with the nurse at the beginning of the year. The parents may want to meet with you as well, but the nurse will for sure go over stuff with the parents as far as blood sugar checks and all that. And then, of course, if we haven't got the DMMP from the parent or the physician yet, we'll have to get that as well. So if you can, by now you should have watched all of the videos in the Safe at Schools, as well as the other links that I've sent for the emergency meds. If you can, just go ahead and complete the test and sign up for a day to do the in-person checkoffs. And once again, we thank you all, the nurses and I, so much for helping take care of these students. It takes a village. And good luck for the 23-24 school year. Please email me or call me if you have any questions, or we can go over them in the in-person checkoffs. Thank you, and enjoy the rest of your summer.